from a country that has a higher incidence. So people who are known contacts of confirmed cases should not travel. So people who are traveling, by definition, are not contacts. So they're not the same category as Maria spoke about. Now, governments and people have to manage a very complex issue here. Managing 2 weeks self-isolation or restricted movement when people arrive in a country is, for a business person, for someone going home to see family, that's quite an imposition. But those individuals are coming from an area of perceived risk in another country. They're not contacts of COVID. And therefore governments are within their rights, if they want to reduce the time of observation that those individuals are in specific self-quarantine or self-restricted movement. That doesn't mean that the person loses responsibility to report symptoms if they get them. So I think that's a flexible number, and it's about the level of imposition it's difficult for people to implement, and it's difficult for governments to monitor. So in a situation like this, I don't know for sure, I haven't seen the issue or the data from the French side of the proposal, but especially if you're focusing in on containing your own major community transmission, and you're focusing on ensuring that your contacts of cases are self-isolating, and you want to track them most aggressively for the 14 days, if people are coming in to your country, in order to reduce the pressure on your follow-up systems, yes, countries could be, it would be a defensible thing to say we'll reduce the period of observation on travellers coming into our country. And again, each government has to set that period. Some governments are moving towards testing regimes, some governments are doing different things. So I do think that's, I won't say a flexible issue, but it's an issue in which governments have choices that they can make. But I would be, I think Maria is correct, contacts of confirmed cases need to be in quarantine for 14 days, and that's not something that we think would be advisable to reduce or adjust in any way.
Thank you, Maria. Thank you, Mike, for this clarification. And to our friends journalists, if you have still any remaining question, please do reach to the media team. We will make sure you have the answer. I do apologize for those who could not get their questions answered. It's already 1 hour press conference, so I will give the final floor to Dr. Tedros, please.
Thank you. Thank you, Fadila. So our message today is for countries to continue to invest in public health and primary health care while fighting COVID. And many countries who have invested in public health and primary health care are responding to the COVID pandemic in a better way. So investment in public health and primary health care is essential. So with that, thank you so much again for joining us, and look forward to seeing you in our next presser. Thank you.
Thank you all. Au revoir.